Okay, thank you, ladies and gentlemen. It is 12 o'clock, so we are going to go ahead and kick off this afternoon's webinar. Thank you for taking the time to join us for our webinar this afternoon, hosted by North Carolina Medical Society Foundation and the North Carolina Medical Group Management Association. My name is Danielle Snyder, and I am with NCMS Foundation. We are thrilled to have you all joining us today. As a reminder, the NCMGMA's mission is to maximize the value and effectiveness of medical practice leaders through educational programs, information exchange, networking, and professional development opportunities. NCMS's mission is to provide leadership in medicine by uniting, serving, and representing physicians and their healthcare teams to enhance the health of North Carolinians. We have enjoyed our collaborations with these monthly lunch and learn webinars we produce for our memberships. In each of our shared educational opportunities, we embody these two missions. This virtual meeting is no exception. Today, our presentation is focused on COVID vaccine planning and resources, a timely topic and one that we are sure many people have their eyes on currently. This webinar will provide an overview of key considerations in planning the COVID-19 vaccine administration program in medical practice, and we'll touch on some available resources that can be accessed to prepare. Throughout the presentation, you can submit your questions in the chat box. We do plan to have time at the end of the presentation to answer your questions. We will also be following up with an email if we happen to get any questions and run out of time, so don't hesitate to submit those in the chat box. We do ask that you stay on mute in an effort to minimize any background noise. We are recording today's presentation, and that will be made available to you after today's session, along with a copy of a PDF of the slides. So without much further ado, I would like to introduce our speaker today, Mr. Bill Shenton. Bill is a partner of Raleigh office of Poynter Spruill. During the course of his law practice, he has represented North Carolina DHHS, and in private practice has represented and advised healthcare providers and organizations in civil and administrative litigation and on various regulatory compliance issues. Bill, thank you so much for taking the time to be here with us today, and I'll go ahead and turn things over to you.
Okay, thank you very much, Danielle. Thank you to the Foundation, to MGMA, for this opportunity to present to you. I should correct one thing that I think may have crept into the written bio that you may have seen. I have not represented DHHS for 40 years. In fact, it was just about 4 or 5 at the beginning of my practice. But just wanted to get that correction out right off the bat. I think it's a great pleasure to be here on such a timely topic. And as I start, I also want to just say thank you to all of you that are managing, providing, supporting these essential services. You're modeling the behaviors for us as a country. You're taking care of us. And now we're at the stage where you're delivering what hopefully will be the vaccine that will take us out of this sort of nightmare that we've been living through and get us back to some semblance of normalcy. A couple disclosures. I have not ever run a medical practice before. I have trouble sometimes managing the top of my desk. So what I have tried to do is to prepare some overview of some points of interest that I thought would be valuable to you as you plan your vaccine program, and give you throughout this presentation, as you'll see, direct links to the information that's available out there. Much of this you may already be familiar with, and some of this may simply confirm what you already have underway. But nevertheless, this will give you a good overview of how to start your vaccine program. And I should also disclose that this is my first Zoom webinar, so Danielle's been very patient with me, and I hope that you will be as well. So here we go. Here we go. Well, there we go. Okay. So these are the points that we're going to cover today. I know that there were a number of liability concerns that came up in some of the chat or the suggestions that you submitted. So we'll go over some state and federal authorities or pertinent points on that. We'll talk about planning your program, vaccine eligibility, who's eligible for it and who isn't. I'm among the lucky few that already has a fully stamped card, 2 Modernas, first one ironically on Inauguration Day, and then the second one a few weeks later per the protocol. We'll also talk about vaccine handling and administration, and there's some very detailed information available. I'm not even going to pretend to be expert or thoroughly versed in that, but I will give you leads and pointers to where you can find that. We'll talk about organizing and training the staff, the individuals that are going to run the whole program, from the person that is holding the clipboards at the doorway all the way through the person who's actually administering the shot. And then finally, we'll look at some HIPAA issues. And hopefully there we go. I'm now hitting the right button. So one thing that I wanted to do as I looked at researching this is to do really just a Google search to see, have there been any cases where the issue of the vaccine has been litigated in terms of its individual delivery. This is a site that cropped up. This link shows you it's nolo.com, which is kind of a legal encyclopedia site. And the only instance that I could find of any sort of lawsuit arising out of an individual vaccine administration, or if you will, the threat of one happening, was a deputy sheriff in New Mexico who sued his employer saying, I don't want to have to get a vaccine. That case was just filed a few weeks ago. No opinion or disposition of the case at this point. So very much in its infancy, and there have been no lawsuits that I can determine or locate where the manner or mode of administration of the vaccine has been an issue that has been litigated. I do want to, as we're at this point in the presentation, emphasize very clearly a couple key points. You won't hear me say today that you have to do steps A to Z or A to whatever to avoid liability. And likewise, you won't hear me say that if you do steps A, B, C, D, E, or whatever, that you are guaranteed to have no liability. This presentation is absolutely not about analyzing or defining what the standard of care is for vaccine administration. Rather, we're going to look at some of the liability state and federal initiatives that have occurred, which I think are pertinent to you and your counsel if and when, or really as you plan your vaccine administration even, and if in the unlikely and unfortunate event that something comes up later. But beyond that, we're going to be focusing on these reference points that are available through various public health agency sites that will guide your planning and preparation. This was Governor Cooper's Executive Order 130, which he issued just a few weeks or a couple months after things started to hit the fan. In it, he emphasized the need for licensing boards to use their discretion to allow healthcare professionals who might be licensed in other states, retired professionals, and even volunteers to provide vaccine support or participate in some way in supporting the vaccine program. The statute that is cited here is in the North Carolina Emergency Medical Act, and it provides some level of immunity from liability for individuals who are working in good faith as part of a response to a declared state of emergency, and if their compensation is limited to actual expenses. So this was not necessarily the full answer in any way, shape, or form to the liability question. And therefore, shortly after the executive order, the General Assembly enacted the North Carolina Emergency or Disaster Treatment Protection Act, which provides more direct protections. It allows for all professionals who are licensed under Chapter 90 or Chapter 90B, which is the social worker statute, as well as healthcare facilities that are licensed under various other statutes, from hospitals all the way down to continuing care retirement communities, to achieve immunity for various COVID treatment related diagnosis and treatment related issues. But also it's noteworthy that the definition of healthcare services in this statute includes not only care to individuals who have COVID-19, but also to other individuals who actually seek care from a provider during the declared COVID-19 emergency. So there is at least some possibility, this has not been interpreted in court, obviously, at this early stage. And that's part of the reason why it's impossible to give you firm legal guidance on where liability would begin or end. But nevertheless, it does create an argument that any sort of treatment, including the administration of a vaccine, should give rise to the immunity provided under the statute. Now, again, that's in flux, nothing definitive yet, but it's something to be aware of. And the other, of course, key point is that the protection is only for actions made in good faith. There's no immunity for gross negligence, reckless misconduct, or intentional harm, as you might expect. In addition to that statute, Governor Cooper, just a couple months ago, or a few weeks ago, also issued Executive Order 193, which directly addresses liability protection for vaccine sites, as long as they are established in accordance with requirements is set up by the North Carolina Department of Health and Human Services. And we'll look at the portal to get into that system. Many of you probably have already become aware of it and maybe are in that portal already, but we'll look at that portal in a few moments. Likewise, there's protection for vaccine workers in the same executive order. So those points that I've just gone over are the things at the state level, the North Carolina level. And now I'd like to turn to a federal statute that's also pertinent on this issue before we move into more of the practical nuts and bolts, steps and links and reference resources for you. There is a thing called the Public Readiness and Emergency Preparedness Act, which was enacted by the Congress in 2005. And it provides immunity in public health emergencies and in other emergencies. In the case of public health, the immunity is triggered because the Secretary of USDHHS is authorized to issue a directive that provides immunity. And this is the slide that we're on right now. Triggered by a declaration by Secretary of USDHHS. And there have been several declarations issued, one in the prior administration by Secretary Azar in late January. The most recent amended declaration was issued this January, and it provides protection to healthcare professionals who are authorized by the pertinent statutes to prescribe, dispense, or administer vaccines and are either actively licensed or have been actively licensed in good standing within the last 5 years. So important to recognize that the federal government is not expanding the scope of practice for any particular license category, but it is recognizing that this immunity will extend to persons who have been licensed in the last 5 years, if in fact, at the time of their licensure, they were in good standing and they were authorized within their scope of practice to administer vaccines. The other key point is buried in the middle of that second full bullet, which is another caveat, which is, and we'll deal with this as a sort of a heads up when we talk about getting the workforce organized, that the liability protection does only apply to professionals who are not on the OIG exclusion list, which I think many of you are aware of what that is and how it operates. And so that will obviously be another checkpoint when it comes to bringing additional people into your work staff, whether retired people or whatever. Okay, so we've now zipped through fairly rapidly, not as rapidly as I hoped, but fairly rapidly, the state and federal pointers, if you will, or reference points on the liability issue. And now we're going to discuss planning. There are a number of aspects to this which are just sort of listed on this slide. The first is to register with the North Carolina Department of Health and Human Services, and we'll get to that link in a moment. Also, and I think this goes without saying, but nevertheless important to emphasize, somebody needs to be in charge of the entire process and have complete purview of everything that needs to happen and understand if there are going to be delegations of particular responsibilities to file, to get up to speed on things or whatever, that there's a complete program and plan in place supervised by one or just a few individuals, depending on the size of your organization, to ensure that the planning steps are rigorously adhered to. One issue will be site management. I took my wife to a dental appointment recently that was in a building where a large provider was doing a vaccine clinic. And when we got there, we had to ride around a while to find a parking place. So sometimes there's some very practical concerns or issues around simply the site. Are you going to use your office? Are you going to use adjacent space? Are you going to use offsite space? Obviously, I don't know whether any of you would be in a circumstance where you'd be conducting drive-in vaccination initiatives. But of course, if that were in your plan or on your horizon, then there are a whole other range of other kinds of site management issues, having personnel, directing traffic, et cetera, that you need to deal with. We'll also deal with vaccine management, which is a fairly complex issue, identifying the population that you'll serve, training your staff, resources to inform the population, and then also following the reporting responsibilities that you'll have. So this is the portal that I mentioned, and here's the link to it. It's been open January 11. Many of you may have already been on it, but this is the place, and I don't know really how this works because I'm not authorized to get in it. I'm not a provider, but this is the starting point where you register to become, to enroll as a provider of the vaccine. And so that is the starting point. There are also a lot of great trainings out there, not just for how you put the shot in the arm, but for the whole scope of everything that you need to have organized to run the program. This is a site that NCDHHS has that shows various guides and recorded trainings. And for instance, there's one portal for the location manager, another portal to manage appointment scheduling. And then we've got more upcoming live training sessions this week that are also shown at that same site. And I think there's one tomorrow, Thursday and Friday, and they give you a brief synopsis of what each of these particular sessions involves. They're typically about roughly an hour long, and they go through the details of some of these nuts and bolts planning things that you need to keep in mind and execute on. Also important, obviously, is to look at the fact sheet for the vaccine that you have. And this is a set of the links that I found in the FDA website for the 3 vaccines that are approved so far. When the next one, I'm blanking on the name right now, but when the next one comes on, there'll be a fact sheet for it. They all have important information about various aspects of the vaccine. For instance, Moderna and Pfizer both make a point of, the Moderna and Pfizer fact sheets both make a point of saying there's no data about the interchangeability of vaccines. Can I get dose 1, one flavor, dose 2, another flavor? No data on that. So obviously, at present, based on the data, there's no basis to switch up the type of vaccine between dose 1 and 2. There are also a lot of details about storage of the vaccines and a great deal of details on preparation, what you have to do with the vial once you've opened it the first time and how that's treated, inspecting the vial when you first bring it out of the storage to begin to use it to administer. And of course, for both Moderna and Pfizer, you've got the, in fact, also for Johnson & Johnson, the requirement to discard doses after 6 hours. There are varying, slightly varying, interestingly, temperature ranges for the vaccines. So it's going to be important that you look in detail at everything that is found in those guidances. Here's our slide that gives you more information about that and summarizes the contents of the various fact sheets. There's also a summary of the clinical trial data. And then finally, I could not find in the FDA fact sheets a clear expression of how you identify the expiration dates for the various vaccines on the vial. And so I ran across this link on the NCDHHS website, which has some information about how to identify the expiration date. So much for the FDA fact sheets. There's a great deal of information in there, and important that whoever is involved in handling the vaccine is aware of the contents and has a good familiarity with how they should proceed. The FDA also has these fact sheets for patients for each of the 3 vaccines with the emergency use authorization to date. And I thought I'd give you those links so you have them handy. When I went for mine, I got one of the fact sheets for the Moderna on my clipboard. And that was one of the first things I had to look over and sign off on. So it's handy that the FDA has made these available and they're easily accessible at these links. Coming now, pardon me one moment. Turning now to the issue of vaccine guidance and who's eligible. You all are probably well aware of this, all the details here, but this is the link where North Carolina is defining who can get the vaccine. At this point, we've got all the groups or the portion of group 4 that are in green that are have the go signal, if you will. The others are on hold, at least at this point, last check. I suppose everybody's aware that the frontline essential workers are defined as people that have to be in work in person and work in manufacturing, educational, essential goods, community health service, and other key enterprises in the economy. But on February 24th, this category was expanded to include childcare workers and pre-K to 12th grade teachers. So that's kind of the current breakdown of who's in the on-deck circle, if you will, for the vaccine. You should also think about, as you enroll your population, to think about and plan for impediments to patient registration. Not everyone has access to a computer or the computer skills. In addition, the Department of Health and Human Services is making a point of saying that you need to think about the impact of a person's disability on their ability to register for the vaccine. So that's another set of issues to sort of delve into for those parts of your patient population or your targeted vaccine recipients who may have issues with a disability that would make it difficult for them to access to register for the vaccine. Also, I wanted to give you a quick look at in case any of you are involved in the operation of affiliated sites in other states. I've not mined these other 4 state sites for details of where they are, for instance, in terms of eligibility of the population, but this will give you a start for Virginia, South Carolina, Tennessee, and Georgia, if that's of interest at all in your planning. I think we're ready to look at who's going to administer the shots. And the medical board issued a statement in February noting a couple key points. First of all, if a physician is going to delegate administration of vaccine, then the physician has some responsibility for determining that the individual has the competencies necessary to carry out that task. And likewise, in the case of the individual licensee, there should be a self-examination of whether there are additional trainings or practices that the individual should go through. For instance, if they've been out of practice for a number of years within the 5-year period that I discussed previously, then that's another concern that the medical board is highlighting for physicians to pay attention to. And then finally, I've got the link to the med board's frequently asked questions on COVID-19 that's shown there at the bottom of this slide. Other boards also, other North Carolina boards have also weighed in, and they have websites. Here are several of them that you may find interesting. And in particular, for instance, if a medical practice is going to bring in a pharmacist to help with the vaccine administration for some reason, or other professionals, here are some of the links that you want to check into on that score. Okay, now you want to identify the staff, and as we've already discussed, the statutes and executive orders that we looked at previously did not expand the scope of practice. So you'll want to look at what licensees are recognized by their respective boards to have the ability and necessary training to actually administer a shot. But of course, there are many, many other steps before people roll up their sleeve. And there's opportunities for any number of people to be involved in the upfront contact, in guiding people through the process, in monitoring people for the required 15-minute or so interval afterwards to make sure that there are no adverse reactions. So there are a lot of opportunities for volunteers other than medical professionals, other than healthcare professionals, to get involved in this. But nevertheless, in identifying the staff that's going to look at the actual administration of the vaccine, you want to be careful about looking into their professional licensure, their status, making sure that they're no more than 5 years retired. And then finally, as I've already mentioned, confirm they're not on the OIG exclusion list, and that's a link to that. People can register on a site operated by the North Carolina Emergency Medical Services Department at this link, so that if you are aware that there are volunteers that would like to help out in some way, shape, or form, this is a site where they can register, and likewise, even healthcare professionals can register at that site. There's also some great CDC training resources. This site has a couple specific things. The first one is the overview of the training for all the staff roles. Second one, the actual vaccine administration protocol and procedure. And then there's also a CDC resource library that we have linked there, which has a whole bunch of different web-based courses. We're now drawing close to the end of what I have to review with you today. so we're probably going to have a good amount of time for questions. This is the HIPAA part of what I wanted to discuss with you. Of course, a vaccination is protected health information. So for those folks who are not healthcare professionals who might come in volunteer in some of the sort of out front roles, if you will, they need to be reminded that they don't need to talk to Mrs. Jones to say, I saw your son getting his vaccine, or your father getting his vaccine. It's not like a visit to the grocery store. It's a healthcare encounter. It's subject to HIPAA, and therefore the vaccine is PHI. HIPAA obviously does permit disclosures of information for public health purposes. That's been in the privacy rule since 2001. But it's important that your staff recognize that this is sensitive healthcare information, and that they be reminded of that in the case of your current work staff, and that you have an actual training session. And, you know, in ideal world, perhaps you have people review a HIPAA fact sheet, or attend a very brief 10 or 15-minute orientation as part of their orientation to their role as a volunteer. And the HIPAA sensitivity would be a key aspect of that. In addition, following the HIPAA minimum necessary disclosure principle, you want to limit the access of PHI to the as much as possible. And really, for a volunteer out front, for instance, the only thing that they really need to have is the name of the individual, match them up with a registration, and be able to enter them into the process of getting a vaccine. Finally, if you are working remotely because you need an alternate site out away from your practice doors, perhaps even a larger venue, given the volume that you're dealing with, it's important that you follow the HIPAA security rule. If there's a laptop that's being used, for instance, that's going to be used to register patients and guide them through the process, or for the intake, that is, then you want to have that laptop encrypted, obviously. You want to have very strict procedures in place for what happens with that laptop when people go to lunch or whatever. And so there are additional security questions that come into play when people are not simply coming through the front door of your practice to get their shots. And a couple other quick notes on HIPAA. The HHS issued an enforcement discretion notification about online scheduling applications. There would be a possibility that they would be deemed to be business associates because they're gathering individuals' names in connection with a COVID-19 vaccine. And so HHS has said it's not going to enforce against the use of these online or web-based vaccine scheduling modules, as long as there's a good faith use, and as long as several other conditions are met. One, the portal, the web access facility has to be non-public facing, so that only the individual registering and your staff can access it. There's a specific requirement that the application be encrypted, and also that any possibility of enabling privacy settings that would limit identifiers, for instance, not a name, but initials, any of those sorts of privacy settings be enabled to limit the amount of personally identifying information that would be provided. And the other point that I wanted to caution you about HIPAA is obviously it will be the case that in a number of circumstances, the media will want to have some nice video to run under its recounting of where we are with HIPAA vaccines. Remember, a few years ago, it wasn't in the COVID times, but previously there was a large tertiary care or teaching hospital in New York that allowed, I think it was a network news crew to come in and film. And that was a violation. That was a HIPAA violation, because obviously you have an image of a patient, you have other protected health information in that environment that would identify potentially what their healthcare status is or some aspect of their care. And therefore, that was a no-no, and there was a fine. And now they're reminding people in this guidance that you can't allow the media in. They do allow less than generously the possibility that if you can be assured that every individual that will be in the area while the film crew is there has signed an authorization. And you all know, I'm sure, what might be involved with an authorization, how detailed that can be. But they're allowing us how, if everybody there signs an authorization, well, fine, you can bring the local news crew in, they can film to their heart's content. But otherwise, that's going to be an issue. And so that is one other thing to think about in your planning. And when you get the call from the local TV station saying, hey, we hear you have a vaccine initiative going on, we'd like to enhance public awareness of this whole situation and bring people in to film what you're doing. Well, the answer has to be no, really, because I don't think you want to go through the possibility of having, of first identifying and being sure that all the individuals that would be filmed have signed an authorization. So that's the couple points that I wanted to mention on HIPAA. And so to wrap this up and allow a little bit of time for questions and for you all to get back to your day-to-day business, what I hope I've given you is a good overview of the resources that you can use to plan your program. Everything from how do I handle the vaccine? How do I get enrolled to get vaccine if I haven't already done that? How do I select and train my staff? And make sure that they understand their roles and their limitations in the case of some of the people that are going to be out front. Look at the vaccine guidelines from the manufacturers in particular, and also from the state and federal agencies, the FDA. Communicate effectively with the recipients, both in terms of registering them and making sure that everybody has fair access to this opportunity. And then also afterwards, making sure that, for instance, in the case of Moderna and Pfizer, that you have established a date when they have to come back. When I got my card, they gave me a date when I was projected to come back. And then, of course, they followed up and called and confirmed. So it's important to communicate with the recipients to make sure that this whole process rolls out as it should, and that nobody is left hanging with only one dose and not getting the second dose, which is, important for getting the full immunity. And then finally, we want to protect the privacy of our patients, and in both, not only as a compliance issue, but also obviously as a gesture to them and in good faith with your obligations to them. So we've run right at, I guess, about 40 minutes or so. And Danielle, I may have run through this too quickly, but I'm ready to try to take a stab at any questions that come up.
Excellent. Thank you so much. I know that was a lot of information squeezed into that 40 minutes. At this time, I don't see any questions that have come up. Just a friendly reminder for those of you that are on, if you do have any questions, please don't hesitate to type those in the chat box. We're happy to answer anything that we can. I know it looks like there's a couple people on the phone, so I don't know if you possibly don't have the opportunity to type into a chat box. If you are on the phone at this time, definitely feel free to unmute yourselves and ask any questions that you may have. While we are waiting to see if that pops up, I will just friendly reminder that this webinar today was recorded. We will be sending out a copy of a link to the recording along with a PDF of all of the slides. I did mention in the chat that PDF does have links that you can click on, so you don't have to copy paste and retype all of those. You will be able to click on those live links when we send that PDF, and it should come to you within the next 24 to 48 hours. There we go. We have a question coming in. Thank you, Catherine. Are there resources for storage of the vaccines?
Yes, that's covered in the FDA guidances in terms of the temperature and so forth. That's covered in each of the guidances. Yeah, I hope that answers the question.
Wonderful, thank you. Yes. Let's see if we have any more coming in. That is a sign when we have limited questions, it's a sign that lots of information was covered and probably answered a lot of questions already. So without seeing any more that are coming in at this moment, I would just like to take this time to thank you again for joining us all today. And thank you, Bill, for your time today and giving this fantastic presentation. Again, this was filled with a lot of information. So thank you for going through all of this. It was a great share for our members and our practices. We appreciate it. Once again, please just keep an eye out.
Thank you for the opportunity and
go ahead.
Thanks for the opportunity, and thank you all listening in for all the good work that you're doing.
Absolutely, definitely. Keep an eye on your emails. We will be sending out, again, a follow-up within the next 24 to 48 hours with all of this information. I hope that everyone has a wonderful day. Please stay safe and stay well. And again, thank you all for the work that you are doing. It is much appreciated. Oh, actually, here we go. Just in the nick of time, we do have another question that has come in. How can we find out where patients have received vaccines outside of North Carolina?
The short answer is I don't know, or I'm not sure, but if you go back to one of the slides, I will take me forever to negotiate back to it, but there we go. These are the links for the other states, and I would assume that would give you a gateway to find more information about their program. And also, if the question is around records at the state level, so those are the links that will hopefully take you there. And please come back to us if that's not precisely your question.
Wonderful, thank you. Is there many resources? Okay, here we go. More questions, I love it. Are patients required to register in CVMS before they receive a dose, or can the practice do that for the patient?
Frankly, I don't know the answer to the question. I think the CVMS site is there for the providers to register. And I think the registration with the patients comes through your individual site once you're enrolled. I believe that to be the case based on my general review of these materials, but I cannot promise you that that's accurate, frankly. I'm
Great.
Sorry, I can't give you a direct answer.
Not a problem. I know there's a lot of information all going around with this. Let's see. Couple more minutes. If there are more questions that are coming in, I will give it just another minute. Before we wrap up, just in case. I feel like every time I'm ready to wrap up, a question pops in. So let's see. And again, if you are joining us by phone and don't have the ability to type in a question, feel free to take yourself off mute. We welcome you to join the conversation as well. Alrighty, well, I say this very slowly, but I don't see any more questions that are coming in at this time. If there are questions that happen to come up after today's presentation, you can feel free to reply to our follow-up email or even to your registration confirmation email, and we can help navigate those questions to make sure they get answered for you also. All right, so all right, I'm still not seeing any more questions in, so I think we're going to wrap up for this afternoon. Again, thank you for our presenter today, Bill, and the information that you have shared with us. Thank you all for taking the time to join us. Everyone, please be well, stay safe, get vaccinated, and have a wonderful afternoon. Happy spring and take care.